Question 1. Operational review demonstrates that a long-term client using a custom-molded backrest is reporting increased discomfort and difficulty maintaining an upright posture during extended sitting periods. The client expresses a desire for a softer backrest to alleviate the pressure points they are experiencing. As the seating and mobility specialist, what is the most appropriate course of action? Option A. Conduct a comprehensive reassessment of the client's current postural needs, including an evaluation of the existing backrest's contour, support, and adjustability, and explore potential modifications or alternative backrest designs that address the underlying biomechanical factors contributing to discomfort and postural changes. Option B. Immediately recommend and procure a new, more heavily padded backrest cushion to address the client's stated preference for a softer feel, assuming this will resolve the discomfort. Option C. Focus on adjusting the client's wheelchair tilt and recline features to compensate for the perceived postural instability, without directly addressing the backrest itself. Option D. Advise the client that their current backrest is likely no longer suitable and suggest a completely different high-end seating system without further investigation into the existing setup. The correct answer is A. Conduct a comprehensive reassessment of the client's current postural needs, including an evaluation of the existing backrest's contour, support, and adjustability, and explore potential modifications or alternative backrest designs that address the underlying biomechanical factors contributing to discomfort and postural changes. Explanation. This scenario presents a common challenge for seating and mobility specialists, SMS, where a client's functional needs evolve, requiring a reassessment of existing equipment. The core of the challenge lies in balancing the client's immediate comfort and perceived needs with the long-term implications for their posture, skin integrity, and overall functional independence, all within the scope of established best practices and regulatory guidelines for seating and mobility provision. The correct approach prioritizes a comprehensive, client-centered assessment that considers the underlying biomechanical and physiological factors contributing to the client's current discomfort and functional limitations. This involves a thorough evaluation of the backrest's current design, its interaction with the client's posture, and the potential for alternative designs or modifications to address the root causes of the issues. This aligns with the ethical imperative to provide services that promote the client's well-being and functional capacity, and with regulatory frameworks that emphasize evidence-based practice and client safety. The focus is on achieving optimal postural support and pressure distribution, which are critical for preventing secondary complications and enhancing quality of life. An incorrect approach would be to simply accede to the client's request for a softer cushion without a thorough assessment. This fails to address the potential underlying issues with the backrest's contour, support, or adjustability, and could exacerbate postural problems or lead to inadequate pressure relief, potentially violating guidelines related to client safety and the provision of appropriate assistive technology. Another incorrect approach would be to recommend a completely new, complex system without first exploring less invasive or more cost-effective modifications to the existing backrest. This could be seen as a failure to provide the most appropriate and resource-efficient solution, potentially contravening principles of responsible practice and value for money. Finally, focusing solely on aesthetics or perceived comfort without a functional assessment neglects the primary purpose of a seating system, which is to provide therapeutic support and promote function, thereby failing to meet the core requirements of the SMS role. Professional decision-making in such situations requires a systematic process. First, actively listen to and validate the client's concerns. Second, conduct a thorough clinical assessment, including observation, measurement, and functional testing. Third, analyze the findings to identify the root causes of the problem. Fourth, explore a range of potential solutions, considering their efficacy, safety, cost-effectiveness, and alignment with client goals. Fifth, discuss these options with the client, empowering them to make an informed decision. And finally, document the assessment, rationale, and chosen intervention meticulously. Question 2. System analysis indicates that a seating and mobility specialist, SMS, is evaluating a client who reports general discomfort but denies any specific pain or visible skin issues. The SMS is tasked with ensuring optimal skin integrity. Which of the following assessment approaches best aligns with best practices and regulatory expectations for this scenario? Option A. Rely solely on the client's verbal report of no pain and no visible skin issues, assuming their current seating system is adequate. Option B. Conduct a thorough visual and tactile examination of the client's skin, paying close attention to bony prominences and areas of potential pressure, while also inquiring about the client's subjective experience of comfort and any changes in sensation. Option C. Focus exclusively on the technical specifications and adjustments of the client's current seating system, assuming any discomfort is unrelated to skin integrity. Option D. Schedule a follow-up appointment for a skin integrity assessment, only if the client reports visible skin breakdown or significant pain at their next scheduled visit. The correct answer is B. Conduct a thorough visual and tactile examination of the client's skin, paying close attention to bony prominences and areas of potential pressure, while also inquiring about the client's subjective experience of comfort and any changes in sensation. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the seating and mobility specialist, SMS, to balance immediate client needs with long-term preventative care, all while adhering to the specific regulatory framework governing their practice. The potential for skin breakdown is a significant risk for individuals using mobility devices, and the SMS's assessment directly impacts the client's comfort, health, and quality of life. The challenge lies in accurately interpreting subtle signs of skin compromise and selecting the most appropriate intervention that aligns with best practices and regulatory expectations for client care and documentation. Correct approach analysis. The correct approach represents best professional practice because it prioritizes a comprehensive, evidence-based assessment that directly addresses the client's current skin condition and potential risk factors. This involves a multifaceted evaluation, including visual inspection of the skin for any signs of redness, pressure, or irritation, palpation to assess tissue temperature and turgor, an inquiry into the client's subjective experience of comfort and sensation. This thoroughness ensures that all relevant data is gathered to inform an accurate diagnosis of skin integrity status and to identify the root causes of any issues. Furthermore, this approach aligns with the ethical imperative to provide client-centered care and the regulatory requirement for accurate and timely documentation of assessments and interventions. By considering the client's functional abilities, current seating system, and daily activities, the SMS can develop a holistic plan that is both effective and sustainable. Incorrect approaches analysis, an approach that solely relies on the client's verbal report without a physical examination, is professionally unacceptable. This fails to meet the regulatory standard for a comprehensive assessment and neglects the ethical duty to actively identify and address potential health risks. Skin integrity issues can be present without overt client complaints, and a visual and tactile assessment is crucial for early detection. Similarly, an approach that focuses only on the seating system's features without evaluating the client's skin condition is inadequate. While the seating system is a critical component, it is the interaction between the system and the client's skin that determines the risk of breakdown. This approach overlooks the direct impact on the client's physiology and fails to address the immediate problem. An approach that delays intervention until significant skin breakdown occurs is also professionally unacceptable. This demonstrates a failure to adhere to preventative care principles, which are often implicitly or explicitly mandated by regulatory bodies focused on client well-being and reducing healthcare complications. Proactive assessment and intervention are hallmarks of best practice and are essential for minimizing harm and associated healthcare costs. Professional reasoning. Professionals should employ a systematic decision-making process that begins with understanding the client's presenting problem and their medical history. This is followed by a thorough hands-on assessment that incorporates both objective findings, visual, tactile, and subjective client reports. The SMS must then synthesize this information, considering the client's unique needs, functional status, and the performance of their mobility equipment. Interventions should be evidence-based, client-centered, and documented meticulously, adhering to all relevant regulatory guidelines for record-keeping and scope of practice. Regular follow-up and reassessment are critical to ensure the effectiveness of interventions and to adapt the plan as the client's condition or needs change. Question 3. The evaluation methodology shows a tendency to rely heavily on standardized outcome measures and clinical observations within a controlled setting, with limited emphasis on direct client interviews regarding personal goals and environmental challenges. Which of the following assessment techniques best addresses this gap to ensure a truly client-centered and functionally relevant seating and mobility solution? Option A, focusing solely on the therapist's clinical judgment and interpretation of the client's physical limitations observed during the assessment. Option B, prioritizing the equipment manufacturer's recommendations based on the client's diagnosed condition, without extensive client input. Option C, incorporating functional task analysis within the client's actual environment and conducting in-depth interviews to understand their daily routines, priorities, and perceived barriers to mobility. Option D, increasing the number of standardized outcome measures administered to gather more quantitative data on the client's physical capabilities. The correct answer is C, incorporating functional task analysis within the client's actual environment and conducting in-depth interviews to understand their daily routines, priorities, and perceived barriers to mobility. Explanation: the evaluation methodology shows a common challenge faced by seating and mobility specialists, SMS, when transitioning from a standardized assessment protocol to a client-centered, functional evaluation. The professional challenge lies in balancing the need for comprehensive, objective data collection with the imperative to understand the individual client's unique needs, goals, and environmental context. This requires a nuanced approach that moves beyond simply ticking boxes on a form to truly understanding the why behind a client's functional limitations and aspirations. Careful judgment is required to ensure the assessment is not only technically sound, but also ethically and practically relevant to the client's life. The correct approach represents best professional practice because it prioritizes the client's active participation and self-determination in the assessment process. By integrating direct observation of functional tasks within the client's natural environment with a thorough discussion of their personal goals and perceived barriers, the SMS is gathering data that is directly applicable to their daily life. This aligns with the ethical principles of client autonomy and beneficence, ensuring that the mobility solution is tailored to enhance the client's quality of life and independence. Furthermore, this approach is more likely to yield accurate and sustainable outcomes, as it is grounded in the client's lived experience and their definition of success. An incorrect approach that relies solely on standardized outcome measures without contextualization fails to capture the client's individual experience and may lead to recommendations that are technically correct but functionally irrelevant or even detrimental. This can be an ethical failure, as it may not adequately serve the client's best interests or respect their autonomy if their unique needs are overlooked. Another incorrect approach that focuses exclusively on the client's reported limitations without objective functional assessment risks over or underestimating their capabilities, potentially leading to inappropriate equipment selection. This could be seen as a failure in professional competence and due diligence. An approach that prioritizes the therapist's interpretation of needs over the client's stated goals, even with objective data, risks imposing external values and may not result in a solution that the client will accept or utilize effectively, thus failing to uphold the principle of client-centered care. The professional decision-making process for similar situations should involve a continuous feedback loop between objective assessment, subjective client input, and environmental observation. Professionals must first establish rapport and clearly communicate the purpose and process of the assessment. They should then employ a multifaceted approach, gathering data through observation, standardized tools, and direct conversation, always prioritizing the client's stated goals and values. Finally, the interpretation of findings and the development of recommendations must be a collaborative process, ensuring the client understands and agrees with the proposed solutions. Question 4. The evaluation methodology shows a client presenting with significant scoliosis, posterior pelvic tilt, and forward head posture. Which of the following assessment sequences best reflects a best practice approach to identifying the primary drivers of these postural deviations for effective seating intervention? Option A. Focus initially on the degree of scoliosis, then assess trunk symmetry, and subsequently evaluate pelvic tilt. Option B. Prioritize the assessment of trunk range of motion, then evaluate head control and finally assess pelvic tilt. Option C. Begin by assessing pelvic alignment and stability, followed by an evaluation of trunk posture and spinal curvature, and conclude with an assessment of head and neck alignment. Option D. Assess head and neck alignment, then evaluate trunk posture, and finally examine pelvic positioning. The correct answer is D. Assess head and neck alignment, then evaluate trunk posture, and finally examine pelvic positioning. Explanation: this scenario presents a common challenge for seating and mobility specialists, SMS, where multiple postural deviations are present, requiring a systematic and evidence-based approach to assessment and intervention. The challenge lies in prioritizing interventions and understanding the interconnectedness of various postural components. A best practice approach necessitates a thorough understanding of biomechanics, functional implications, and the client's specific goals, all within the framework of relevant professional standards and ethical guidelines. The correct approach represents best professional practice because it employs a hierarchical assessment, starting with the most foundational postural element that influences others. By first addressing pelvic alignment, the SMS acknowledges that the pelvis serves as the base of support for the entire trunk and head. Proper pelvic positioning is critical for achieving optimal spinal curvature and head control. This aligns with the principles of evidence-based practice, which emphasizes a systematic and logical progression in assessment to ensure that interventions are targeted and effective. This approach also prioritizes client function and comfort, as improved pelvic stability can lead to better trunk support, reduced fatigue, and enhanced participation in daily activities. An incorrect approach that focuses solely on head control without first assessing and optimizing pelvic alignment is professionally unacceptable. This failure stems from a lack of understanding of the kinetic chain and the foundational role of the pelvis. It represents a potential ethical failure by not employing the most effective and efficient assessment strategy, potentially leading to suboptimal outcomes or the need for repeated interventions. Similarly, an approach that prioritizes trunk alignment without considering the pelvic base is flawed. While trunk alignment is important, it is often a consequence of pelvic position. Neglecting the pelvis can lead to compensatory strategies that do not address the root cause of trunk asymmetry. This could be considered a failure to adhere to professional standards of care, which mandate a comprehensive and integrated assessment. The professional decision-making process for similar situations should involve a systematic review of the client's current presentation, identification of all observed postural deviations, and a consideration of their functional impact. The SMS should then consult relevant clinical guidelines and evidence to determine the most appropriate order of assessment, prioritizing foundational elements that influence subsequent postural components. This involves a critical evaluation of how each postural element interacts and how addressing one might positively or negatively impact others. The ultimate goal is to develop an intervention plan that is client-centered, functionally relevant, and based on sound biomechanical principles. Question 5. Governance review demonstrates a recent client report of persistent discomfort and perceived instability with their provided seating and mobility equipment, despite a recent provision. The Seating and Mobility Specialist, SMS, is tasked with addressing this situation. Which of the following approaches best reflects a responsible and effective response to this client's concerns, prioritizing their ongoing postural control and stability? Option A. Recommend the immediate procurement of entirely new, more complex seating and mobility equipment, without a detailed reevaluation of the client's current needs and the existing system's performance. Option B. Immediately proceed with minor, superficial adjustments to the current seating system based on the client's subjective report of instability. Option C. Conduct a comprehensive reassessment of the client's current postural control, stability, functional needs, and the performance of the existing equipment in their daily environment. Option D. Advise the client to simply try to adapt to the current equipment, suggesting that discomfort and instability are common with advanced mobility devices. The correct answer is C. Conduct a comprehensive reassessment of the client's current postural control, stability, functional needs, and the performance of the existing equipment in their daily environment. Explanation: this scenario is professionally challenging because it requires a seating and mobility specialist, SMS, to balance the immediate need for a client's functional improvement with the long-term implications of their postural control and stability. The client's reported discomfort and perceived instability, despite a recent equipment provision, necessitates a thorough reassessment rather than a simple adjustment. The challenge lies in discerning the root cause of the instability, whether it's a mismatch in the equipment's ability to support the client's current postural needs, a change in the client's condition, or an issue with the initial assessment or fitting process. Careful judgment is required to avoid making assumptions and to ensure the client's safety, comfort, and continued participation in their daily activities. The correct approach represents best professional practice because it prioritizes a comprehensive, client-centered reassessment. This aligns with the ethical obligation to provide services that are appropriate and beneficial to the client. By conducting a thorough evaluation of the client's current postural control, stability, and functional needs, the SMS can identify the underlying issues. This systematic approach ensures that any subsequent recommendations for equipment modification or replacement are evidence-based and directly address the client's presenting problems, thereby promoting optimal outcomes and preventing further complications or dissatisfaction. This adheres to the principles of professional competence and client welfare, which are foundational to the SMS certification. An incorrect approach that involves making immediate, minor adjustments to the existing seating system without a full reassessment is professionally unacceptable. This could lead to a superficial fix that masks a more significant underlying problem, potentially compromising the client's safety and exacerbating their discomfort or instability. Ethically, this approach fails to uphold the duty of care by not thoroughly investigating the client's needs and could be seen as a failure to provide competent service. It risks not only client harm, but also a breach of professional standards by not adhering to a systematic problem-solving process. Another incorrect approach, such as immediately recommending entirely new, more complex equipment based solely on the client's subjective report of instability, is also professionally unsound. This bypasses the critical step of understanding why the current system is not meeting needs. It could result in an unnecessary expenditure for the client and the healthcare system, and the new equipment might not even address the actual cause of the instability if the root issue is not equipment-related. This demonstrates a lack of due diligence and a failure to apply a systematic, evidence-based approach to problem-solving, potentially violating principles of resource stewardship and client-centered care. The professional decision-making process for similar situations should involve a structured approach. 1. Acknowledge and validate the client's reported concerns. 2. Initiate a comprehensive reassessment of the client's current physical status, functional ability, and environmental context. 3. Analyze the findings from the reassessment to identify the root cause of the reported instability and discomfort. 4. Consider all potential solutions, including adjustments to existing equipment, modifications, or entirely new equipment, based on the reassessment findings and evidence-based practice. 5. Collaborate with the client and other relevant stakeholders in the decision-making process. 6. Document the entire process, including assessment findings, rationale for recommendations, and client involvement. Question 6. Market research demonstrates that peer recommendations can significantly influence consumer choices in assistive technology. A client who is seeking a new wheelchair and seating system expresses a strong preference for a specific model they saw a friend using, stating it looks really good, and their friend says it's the best. As a seating and mobility specialist, SMS, what is the most appropriate professional approach to address this client's expressed preference while ensuring the best possible outcome? Option A. Focus the assessment primarily on the features of the preferred wheelchair model, seeking to confirm if it meets the client's basic functional requirements, and then proceed with that recommendation if it appears adequate. Option B. Immediately recommend the wheelchair model the client prefers, as their satisfaction with the equipment is paramount and peer endorsements are generally reliable indicators of quality. Option C. Advise the client that their personal aesthetic preferences and peer recommendations are secondary to the clinical recommendations of the SMS, and proceed with prescribing the system the SMS deems most appropriate without further discussion of the client's initial preference. Option D. Conduct a thorough, individualized assessment of the client's functional needs, physical status, environmental context, and long-term goals, and then present a range of appropriate wheelchair and seating system options that meet these clinical criteria, discussing the pros and cons of each, including the client's preferred model if it aligns with clinical recommendations. The correct answer is D. Conduct a thorough, individualized assessment of the client's functional needs, physical status, environmental context, and long-term goals, and then present a range of appropriate wheelchair and seating system options that meet these clinical criteria, discussing the pros and cons of each, including the client's preferred model if it aligns with clinical recommendations. Explanation. This scenario is professionally challenging because it requires a seating and mobility specialist, SMS, to to balance the immediate needs of a client with the long-term implications of equipment selection, all while adhering to the specific regulatory framework governing their practice. The client's expressed preference for a particular wheelchair model, based on anecdotal evidence from a peer, introduces a significant variable that must be critically evaluated against objective clinical assessment and evidence-based practice. The SMS must navigate the potential for personal bias, the influence of social proof, and the ethical imperative to provide the most appropriate and safe solution, rather than simply the most desired one. The correct approach represents best professional practice because it prioritizes a comprehensive, individualized assessment that aligns with the principles of evidence-based practice and client-centered care, as mandated by the SMS certification guidelines. This involves a thorough evaluation of the client's functional needs, physical status, environmental factors, and long-term goals. By gathering objective data and considering a range of appropriate options, the SMS ensures that the recommended wheelchair and seating system is not only acceptable to the client, but also clinically sound, safe, and likely to optimize their mobility, comfort, and participation. This aligns with the ethical obligation to act in the client's best interest and to maintain professional competence through ongoing learning and application of current knowledge. An incorrect approach that solely relies on the client's stated preference without independent clinical validation would be professionally unacceptable. This fails to uphold the SMS's responsibility to provide expert advice and to ensure the safety and efficacy of the prescribed equipment. It risks prescribing a system that may be aesthetically pleasing or socially endorsed but functionally inadequate, potentially leading to poor posture, skin breakdown, pain, or reduced mobility, thereby violating the duty of care. Another incorrect approach that prioritizes the most readily available or cost-effective option without a thorough assessment would also be a failure. This prioritizes expediency or financial considerations over the client's well-being and optimal functional outcomes, which is contrary to the ethical principles of providing appropriate care and advocating for the client's needs. A professional decision-making process for similar situations should involve a systematic approach. 1. Initiate with a comprehensive client assessment, gathering objective data on physical, functional, and environmental factors. 2. Critically evaluate client preferences and external influences, like peer recommendations, against clinical findings and evidence-based practice. 3. Explore a range of appropriate equipment options that meet the identified clinical needs, considering their features, benefits, and limitations. 4. Engage the client in a collaborative decision-making process, explaining the rationale behind recommendations and addressing their concerns. 5. Document the assessment, rationale for recommendations, and the client's informed consent. 6. Follow up to ensure the equipment meets the client's needs and adjust as necessary. Question 7. System analysis indicates that a client expresses a strong preference for a specific seating depth that feels just right to them, even though preliminary measurements suggest this depth might be slightly shorter than typically recommended for optimal thigh support and pressure distribution, according to standard SMS fitting protocols. The SMS must decide how to proceed with the wheelchair fitting. Which of the following actions best reflects the professional and regulatory obligations of a seating and mobility specialist? Option A. Implement the client's preferred seating depth without further discussion, assuming their subjective feeling is the most important factor in equipment selection. Option B. Refuse to proceed with the fitting until the client agrees to the standard recommended seating depth, emphasizing that deviating from established protocols is not permissible. Option C. Proceed with the client's preferred seating depth, documenting their explicit request and understanding of potential implications, while also exploring minor adjustments to other seating dimensions to compensate where possible. Option D. Immediately disregard the client's preference and insist on the standard recommended seating depth based on the preliminary measurements, explaining that regulatory guidelines supersede personal comfort. The correct answer is C. Proceed with the client's preferred seating depth, documenting their explicit request and understanding of potential implications, while also exploring minor adjustments to other seating dimensions to compensate where possible. Explanation. This scenario is professionally challenging because it requires the seating and mobility specialist, SMS, to balance the immediate needs and preferences of the client with the long-term functional implications of wheelchair measurements and fitting. The client's subjective experience of comfort is crucial, but it must be integrated with objective biomechanical principles, and the specific regulatory requirements for safe and effective equipment provision. The SMS must navigate potential conflicts between the client's desires and what is clinically and regulatorily appropriate, ensuring the chosen measurements will support optimal posture, function, and prevent secondary complications, all while adhering to the standards set forth by the relevant certification body. The correct approach represents best professional practice because it prioritizes a comprehensive assessment that integrates subjective client feedback with objective measurements and functional evaluation. This aligns with the ethical obligation to provide client-centered care, ensuring the wheelchair is not only comfortable, but also promotes independence, safety, and well-being. Adherence to established measurement protocols and fitting guidelines, as dictated by the SMS certification framework, ensures that the equipment meets functional requirements and regulatory standards for efficacy and safety. This holistic approach minimizes the risk of ill-fitting equipment, which can lead to pain, pressure injuries, postural deformities, and reduced functional capacity, thereby upholding the professional's duty of care. An incorrect approach that solely relies on the client's immediate comfort without considering long-term functional outcomes or biomechanical principles fails to meet the professional standard of care. This could lead to a wheelchair that feels good initially, but ultimately compromises posture, causes pain over time, or exacerbates existing conditions, potentially violating ethical guidelines related to providing appropriate and effective equipment. Another incorrect approach that prioritizes speed or ease of measurement over thoroughness risks overlooking critical factors that impact the client's long-term health and mobility. This could result in a poorly fitting device that does not adequately support the client, leading to potential safety hazards or the need for premature equipment replacement, which is not cost-effective or in the client's best interest. Furthermore, disregarding established measurement protocols or fitting guidelines, even if the client expresses satisfaction, represents a failure to adhere to the regulatory framework of the SMS certification, potentially compromising the integrity of the certification and the safety of the client. The professional decision-making process for similar situations should involve a systematic approach. First, actively listen to and understand the client's stated needs and preferences. Second, conduct a thorough objective assessment, including relevant biomechanical measurements and functional evaluations, referencing the specific guidelines of the SMS certification. Third, critically analyze how the objective findings and client input align with best practices and regulatory requirements. Fourth, educate the client about the rationale behind recommended measurements and fitting adjustments, explaining the potential benefits and risks of different options. Finally, collaboratively determine the optimal solution that balances client satisfaction with functional efficacy, safety, and regulatory compliance. Question 8. Market research demonstrates that clients often express a strong preference for seating solutions that are perceived as immediately comfortable and easy to adjust. As a seating and mobility specialist, SMS, how should you prioritize these client preferences when selecting a pressure redistribution surface, considering the primary goal of preventing pressure injuries? Option A. Recommend a seating surface that is widely recognized for its ease of use and adjustability, assuming that such features inherently contribute to better pressure redistribution and client adherence. Option B. Integrate the client's expressed preferences for comfort and ease of use into the selection process, but only after a thorough assessment of their pressure injury risk factors and the pressure redistribution capabilities of potential surfaces, ensuring the chosen solution effectively mitigates risk while respecting their needs. Option C. Focus primarily on the pressure redistribution capabilities of the seating surface, explaining to the client that comfort and ease of use are secondary to the prevention of serious health complications like pressure injuries. Option D. Select the seating surface that the client finds most comfortable and easiest to operate, as client satisfaction is the paramount consideration in all seating and mobility interventions. The correct answer is B. Integrate the client's expressed preferences for comfort and ease of use into the selection process, but only after a thorough assessment of their pressure injury risk factors and the pressure redistribution capabilities of potential surfaces, ensuring the chosen solution effectively mitigates risk while respecting their needs. Explanation. This scenario is professionally challenging because it requires the seating and mobility specialist, SMS, to balance the immediate needs and preferences of a client with the long-term health implications of pressure redistribution. The client's desire for comfort and ease of use, while valid, must be weighed against the potential for skin breakdown and associated complications, which can significantly impact their quality of life and healthcare costs. Careful judgment is required to ensure the chosen seating solution not only meets the client's functional requirements, but also adheres to best practices in pressure injury prevention, as guided by relevant professional standards and regulatory frameworks. The correct approach represents best professional practice because it prioritizes a comprehensive assessment that integrates the client's subjective experience with objective clinical data and an understanding of pressure redistribution principles. This aligns with the ethical obligation of an SMS to act in the client's best interest, promoting their health and well-being. Specifically, it adheres to the principles of evidence-based practice, which mandates the use of interventions supported by research and clinical expertise to prevent pressure injuries. This approach also reflects a commitment to patient-centered care, ensuring the client's values and preferences are considered within the framework of clinical necessity and regulatory compliance. An incorrect approach that solely focuses on immediate client comfort without adequately assessing pressure redistribution risks would be professionally unacceptable. This failure would violate the ethical duty to prevent harm and could lead to the development of pressure injuries, which are preventable conditions. Such an approach would also contravene professional standards that emphasize the importance of proactive risk management in seating and mobility interventions. Furthermore, neglecting the principles of pressure redistribution could be seen as a failure to uphold the standards of care expected of a certified SMS, potentially leading to adverse client outcomes and professional repercussions. Another incorrect approach that prioritizes a specific product solely based on its perceived ease of use or marketing claims, without a thorough evaluation of its pressure redistribution capabilities in relation to the client's specific needs and risk factors, would also be professionally unacceptable. This demonstrates a lack of critical evaluation and a potential failure to adhere to the principles of evidence-based practice. It could also lead to the selection of a suboptimal solution that does not effectively mitigate pressure-related risks, thereby failing to meet the client's overall needs and potentially causing harm. The professional decision-making process for similar situations should involve a systematic approach. First, conduct a thorough client assessment, including a detailed history, physical examination, and evaluation of functional needs and environmental factors. Second, identify the client's risk factors for pressure injury development. Third, apply knowledge of pressure redistribution principles and available seating technologies, considering the evidence supporting their efficacy for the specific client. Fourth, engage in shared decision-making with the client, discussing the benefits and limitations of different options, including their impact on pressure redistribution and comfort. Fifth, document the assessment, rationale for the chosen intervention, and the client's informed consent. Finally, establish a plan for ongoing monitoring and reassessment to ensure the continued effectiveness of the seating solution and to address any emerging issues. Question 9. Assessment of a client's functional mobility and activity levels for seating and mobility device prescription requires a comprehensive approach. Given a client who expresses a strong desire to independently navigate their local shopping center, but whose current observed functional mobility is limited to short-distance ambulation within their home with a walker, what is the most appropriate next step for a seating and mobility specialist? SMS. Option A. Advise the client that their current functional mobility is insufficient for independent community ambulation and focus solely on improving their indoor mobility with their existing walker. Option B. Ask the client to trial a manual wheelchair at the shopping center to see if they can manage it independently before considering other options. Option C. Immediately recommend a power wheelchair as the most suitable device to ensure the client can achieve their stated goal of independent community ambulation, given their expressed desire. Option D. Conduct a thorough environmental assessment of the local shopping center, including terrain, accessibility features, and potential hazards, and explore adaptive strategies and assistive devices that could support the client's goal, while also assessing their current functional capacity for such an endeavor. The correct answer is D. Conduct a thorough environmental assessment of the local shopping center, including terrain, accessibility features, and potential hazards, and explore adaptive strategies and assistive devices that could support the client's goal, while also assessing their current functional capacity for such an endeavor. Explanation. Scenario analysis. This scenario presents a common challenge for seating and mobility specialists, SMS, where a client's stated functional goals may not align with their current observed activity levels or the practicalities of their environment. The challenge lies in balancing client autonomy and aspirations with realistic, safe, and effective mobility solutions. Overlooking the discrepancy between stated goals and observed function can lead to inappropriate equipment prescription, potential safety risks, and ultimately, client dissatisfaction and suboptimal outcomes. The SMS must navigate this by employing a comprehensive assessment process that goes beyond self-report. Correct approach analysis. The correct approach involves a multifaceted assessment that integrates the client's stated goals with objective observations of their functional mobility and activity levels within their typical environment. This aligns with best professional practice as outlined by the Seating and Mobility Specialist (SMS) certification framework, which emphasizes a holistic and client-centered approach. It requires the SMS to gather information from multiple sources, including direct observation, caregiver input, and environmental assessment, to form a comprehensive understanding of the client's needs and capabilities. This evidence-based approach ensures that the recommended mobility solution is not only aligned with the client's desires, but also safe, functional, and sustainable within their daily life, thereby maximizing independence and quality of life. This adheres to ethical principles of beneficence and non-maleficence by ensuring the proposed solution promotes well-being and avoids harm. Incorrect approaches analysis. One incorrect approach involves solely relying on the client's stated desire for independent community ambulation, without a thorough assessment of their current functional mobility and the feasibility of achieving this goal, given their physical condition and environmental barriers. This approach fails to uphold the SMS's professional responsibility to conduct a comprehensive evaluation and could lead to the prescription of inappropriate equipment that is unsafe or ineffective, potentially causing harm and violating the principle of non-maleficence. It also disregards the need for evidence-based practice, which requires objective data to support recommendations. Another incorrect approach is to dismiss the client's stated goals entirely based on initial observations of limited activity, without further investigation or exploration of potential interventions. This can be perceived as paternalistic and disrespectful of client autonomy, a core ethical principle. While realistic assessment is crucial, a complete disregard for the client's aspirations can lead to disengagement and a failure to identify underlying factors that might be limiting their activity, such as fear of falling, pain, or lack of appropriate support. This approach neglects the importance of motivational interviewing and collaborative goal setting. A third incorrect approach is to focus exclusively on the most advanced mobility equipment that could theoretically support the client's stated goal, without adequately assessing their current functional capacity, endurance, or the practicalities of using such equipment in their daily environment. This can lead to overprescription, which is not only costly, but also may result in the equipment being underutilized or even abandoned due to its complexity or the client's inability to manage it effectively. This violates the principle of proportionality and responsible resource utilization. Professional reasoning. Professionals should employ a systematic decision-making process that begins with active listening and empathetic engagement with the client to understand their goals and motivations. This is followed by a comprehensive, multidimensional assessment that includes direct observation of functional mobility in various contexts, evaluation of strength, endurance, balance, and coordination, and an analysis of the client's home, work, and community environments. The SMS should then synthesize this information, collaboratively discuss the findings with the client and their support network, and explore a range of potential solutions, from adaptive strategies and therapeutic interventions to various mobility equipment options. The final recommendation should be a well-justified, evidence-based plan that balances the client's aspirations with their functional capabilities and environmental realities, prioritizing safety, independence, and quality of life. Question 10. Comparative studies suggest that while basic mobility aids like walkers, canes, and crutches offer varying degrees of support, the most effective selection for an individual hinges on a nuanced understanding of their functional capacity and environmental demands. Considering this, which approach to selecting a mobility aid for a client with mild gait instability and a history of falls in their home environment is most aligned with best professional practice for a seating and mobility specialist? Option A. Recommend a single-point cane as it is less cumbersome and allows for greater maneuverability within the home. Option B. Conduct a comprehensive assessment of the client's functional abilities, home environment, and stated goals. Then recommend a mobility aid that best addresses their specific needs for safety and independence, with consideration for potential future changes. Option C. Select a forearm crutch as it offers more support than a cane and is often recommended for individuals with a history of falls. Option D. Prescribe a standard walker as it is generally considered the most stable and easiest to learn for individuals with mild gait instability. The correct answer is B. Conduct a comprehensive assessment of the client's functional abilities, home environment, and stated goals. Then recommend a mobility aid that best addresses their specific needs for safety and independence, with consideration for potential future changes. Explanation. Scenario analysis. This scenario presents a common challenge for seating and mobility specialists, SMS, where multiple mobility aids could potentially meet a client's immediate needs. The professional challenge lies in moving beyond a superficial assessment of basic mobility support to a comprehensive evaluation that considers long-term functional outcomes, safety, and the client's evolving needs and environment. A superficial approach risks prescribing a device that is inadequate, unsafe, or leads to secondary complications, impacting the client's quality of life and potentially increasing healthcare costs. Careful judgment is required to balance immediate functional improvement with sustainable, client-centered care. Correct approach analysis. The correct approach prioritizes a thorough client assessment that encompasses not only their current mobility limitations, but also their functional goals, home and community environments, cognitive status, and potential for progression or regression. This aligns with the core principles of person-centered care and the ethical obligations of an SMS to provide solutions that promote independence, safety, and well-being. Specifically, it reflects the regulatory framework's emphasis on evidence-based practice and the need for individualized care plans. By considering the client's ability to learn and adapt to different assistive devices, and by evaluating the specific demands of their daily activities, the SMS ensures the chosen mobility aid is not just a temporary fix, but a sustainable tool for enhancing their life. This approach also implicitly addresses the need for ongoing reassessment, a key component of effective mobility support. Incorrect approaches analysis. One incorrect approach focuses solely on the most readily available or familiar mobility aid without a comprehensive assessment. This fails to meet the regulatory requirement for individualized care and can lead to prescribing a device that is not optimally suited for the client's specific needs, potentially causing harm or hindering progress. Ethically, it represents a lapse in due diligence and a failure to act in the client's best interest. Another incorrect approach might prioritize a device based on perceived ease of use or cost-effectiveness, without adequately considering the client's long-term functional goals or potential for future needs. This can result in a suboptimal outcome, where the client may become dependent on a less effective device or require more complex interventions later. This approach violates the ethical principle of beneficence and may not align with regulatory guidelines that mandate the provision of the most appropriate and effective solutions. A third incorrect approach could involve recommending a mobility aid based on the recommendations of a non-SMS professional without independent verification of its suitability. While collaboration is important, the SMS has a specific scope of practice and responsibility to conduct their own thorough assessment. Relying solely on external recommendations without due diligence can lead to errors in judgment and potentially compromise client safety and care quality, which is a regulatory and ethical failure. Professional reasoning. Professionals should employ a systematic, client-centered assessment process. This involves active listening to the client's stated needs and goals, observing their functional abilities in various contexts, and gathering information about their environment and support systems. The decision-making process should be guided by evidence-based practice, considering the efficacy and safety profiles of different mobility aids in relation to the client's unique profile. Professionals must also be aware of and adhere to all relevant regulatory standards and ethical codes, ensuring that their recommendations are always in the best interest of the client and promote their independence and quality of life. Regular reassessment and adaptation of the mobility plan are crucial components of this ongoing professional responsibility. Question 11. The efficiency study reveals that a particular client who has expressed a strong preference for a lightweight, highly maneuverable manual wheelchair for daily community ambulation has significant postural instability and a history of falls when attempting to propel themselves over uneven terrain. The specialist has assessed that a power-assisted wheelchair or a power wheelchair would offer greater stability and reduce the risk of falls, but the client is resistant to these options due to perceived complexity and a desire for independence associated with manual propulsion. Option A. Document the client's preference for the manual wheelchair and the specialist's concerns about fall risk, but ultimately provide the manual wheelchair as requested, assuming the client will adapt or seek further assistance if issues arise. Option B. Immediately order the lightweight, highly maneuverable manual wheelchair as requested by the client to ensure client satisfaction and autonomy, regardless of the specialist's assessment of increased fall risk. Option C. Inform the client that their preference is not suitable due to the identified risks and proceed with ordering a power-assisted wheelchair without further discussion, as this is the specialist's professional judgment. Option D. Conduct a thorough reassessment focusing on the client's specific functional limitations and safety concerns related to uneven terrain, and then collaboratively discuss the risks and benefits of various mobility options, including the client's preferred manual wheelchair and alternative powered options, to reach an informed, shared decision. The correct answer is D. Conduct a thorough reassessment focusing on the client's specific functional limitations and safety concerns related to uneven terrain, and then collaboratively discuss the risks and benefits of various mobility options, including the client's preferred manual wheelchair and alternative powered options, to reach an informed, shared decision. Explanation. Scenario analysis. This scenario presents a conflict between a client's stated preference and the specialist's professional judgment regarding the most appropriate seating and mobility solution. The challenge lies in balancing client autonomy with the ethical and professional responsibility to provide evidence-based, safe, and effective interventions. The specialist must navigate potential pressure to conform to the client's wishes while upholding the principles of good practice and client well-being. Correct approach analysis. The correct approach involves a thorough, client-centered assessment that prioritizes the client's functional needs, safety, and long-term well-being, even if it means gently challenging the client's initial request. This aligns with the core principles of the Seating and Mobility Specialist (SMS) certification, which emphasizes evidence-based practice, client-centered care, and the provision of solutions that promote optimal function and safety. It requires open communication, education, and collaborative decision-making, ensuring the client understands the rationale behind alternative recommendations. This approach upholds the ethical duty to act in the client's best interest, as mandated by professional codes of conduct for healthcare professionals. Incorrect approaches analysis. One incorrect approach involves immediately acquiescing to the client's request without a comprehensive assessment or exploration of alternatives. This fails to meet the professional standard of care by potentially overlooking critical functional deficits or safety risks associated with the requested solution. It could lead to suboptimal outcomes, increased risk of injury, and a failure to address the underlying mobility and seating needs effectively. This approach also undermines the specialist's role as an expert advisor. Another incorrect approach is to dismiss the client's request outright, without adequate explanation or exploration of their reasoning. This demonstrates a lack of respect for client autonomy and can damage the therapeutic relationship. While the specialist may have valid concerns, a confrontational or dismissive stance is unprofessional and counterproductive to achieving a collaborative and effective outcome. It fails to acknowledge the client's lived experience and potential factors influencing their preference. A third incorrect approach is to proceed with the client's request while secretly believing it is inappropriate, without any attempt to educate or guide the client towards a more suitable option. This represents a significant ethical lapse, as it involves providing a potentially substandard or unsafe intervention without transparency. It violates the principle of informed consent and the duty to provide competent care. Professional reasoning. Professionals should employ a systematic decision-making process that begins with a comprehensive client assessment. This includes understanding the client's goals, functional abilities, environmental context, and any specific preferences or concerns. Following the assessment, the specialist should engage in open and honest communication with the client, explaining their findings and recommendations in clear, understandable terms. This involves educating the client about the benefits and drawbacks of various options, including their initial request and any proposed alternatives. The goal is to empower the client to make an informed decision, with the specialist acting as a trusted advisor. If there is a significant discrepancy between the client's preference and the specialist's professional recommendation, further exploration of the client's rationale and a collaborative problem-solving approach are essential. The ultimate decision should be a shared one, prioritizing the client's safety, function, and overall well-being within the bounds of professional expertise and ethical practice. Question 12. To address the challenge of comprehensively assessing a client's seating and mobility needs, which of the following approaches best balances direct observation with effective client interviewing to ensure an accurate and client-centered evaluation? Option A. Rely primarily on family members' descriptions of the client's mobility challenges and seating preferences, with minimal direct interaction or observation of the client themselves. Option B. Engage in an open-ended conversation with the client, while observing their natural interactions within their home environment, asking clarifying questions as needed to explore observed behaviors and stated needs. Option C. Perform a detailed physical examination of the client's musculoskeletal system, followed by a direct request for the client to list their desired equipment without further discussion or environmental observation. Option D. Conduct a structured interview using a predefined questionnaire covering all potential seating and mobility issues, followed by a brief observation of the client performing a few standardized tasks. The correct answer is D. Conduct a structured interview using a predefined questionnaire covering all potential seating and mobility issues, followed by a brief observation of the client performing a few standardized tasks. Explanation. This scenario presents a professional challenge because the seating and mobility specialist, SMS, must gather comprehensive information to accurately assess a client's needs, while respecting their autonomy and ensuring the information obtained is relevant and actionable. The challenge lies in balancing thoroughness with efficiency and client comfort, all within the ethical and regulatory boundaries of practice. Careful judgment is required to select observation and interview techniques that are both effective and appropriate. The correct approach represents best professional practice because it prioritizes a client-centered, holistic assessment. By combining direct observation of the client in their environment with open-ended interview questions that encourage detailed responses, the SMS can gain a nuanced understanding of the client's functional abilities, environmental barriers, and personal preferences. This multimodal approach aligns with the ethical principles of beneficence and non-maleficence, ensuring the client's well-being and avoiding harm through misassessment. It also adheres to professional standards that mandate thorough and individualized assessments. An incorrect approach that relies solely on passive observation without engaging the client fails to capture the client's subjective experience, motivations, and perceived needs, potentially leading to an incomplete or inaccurate assessment. This could violate the principle of respecting client autonomy by not actively seeking their input. Another incorrect approach that focuses exclusively on a checklist of questions, without allowing for spontaneous observation or follow-up, risks a superficial understanding and may miss critical contextual factors influencing mobility and seating requirements. This could be seen as a failure to provide a truly individualized assessment, a core tenet of professional practice. An approach that involves leading questions or making assumptions based on initial observations can introduce bias and compromise the objectivity of the assessment, potentially leading to inappropriate recommendations and failing to meet the client's actual needs. This directly contradicts the ethical obligation to provide unbiased and evidence-based recommendations. Professionals should employ a decision-making framework that begins with understanding the client's stated goals and concerns. This should be followed by a plan for data collection that includes both objective observation and subjective inquiry, tailored to the individual. The SMS should continuously evaluate the information gathered, seeking clarification and further detail as needed, and be prepared to adapt their techniques based on the client's responses and environmental cues. This iterative process ensures that the assessment remains client-focused and leads to the most appropriate and effective seating and mobility solutions. Question 13. Strategic planning requires a seating and mobility specialist, SMS, to consider various seating components for a client with a history of pressure injuries and moderate postural support needs. The client expresses a strong preference for a visually appealing cushion and backrest that is readily available through a local supplier. The SMS has identified several options, each with different material compositions, pressure redistribution capability. Maintenance requirements. Considering the client's medical history and the importance of long-term well-being, which of the following approaches best aligns with professional standards and ethical obligations for an SMS? Option A. Focus on the aesthetic appeal of the seating components, as this is a significant factor in client compliance and overall satisfaction, and choose options that are visually pleasing and easily sourced. Option B. Prioritize a comprehensive assessment of the client's skin integrity, postural support requirements, and functional goals. Then select cushion and backrest materials and designs that offer superior pressure redistribution, breathability, and ease of cleaning, even if they are not the client's initial aesthetic preference or the most readily available. Option C. Recommend the seating components that the client has expressed a preference for, as client satisfaction is paramount, and ensure the local supplier can provide them quickly to address the client's immediate needs. Option D. Select the most cost-effective cushion and backrest options that appear to offer basic comfort, assuming that any available option from a local supplier will be adequate for the client's needs. The correct answer is B. Prioritize a comprehensive assessment of the client's skin integrity, postural support requirements, and functional goals. Then select cushion and backrest materials and designs that offer superior pressure redistribution, breathability, and ease of cleaning, even if they are not the client's initial aesthetic preference or the most readily available. Explanation. This scenario presents a common challenge for seating and mobility specialists, SMS, where client needs, available resources, and regulatory compliance intersect. The primary challenge lies in balancing the client's immediate comfort and functional requirements with the long-term implications of material selection, durability, and potential for skin breakdown, all within the scope of established best practices and any applicable funding or reimbursement guidelines. Careful judgment is required to ensure the chosen seating components not only meet the client's current needs, but also contribute to their overall health and well-being, while adhering to professional standards. The correct approach prioritizes a comprehensive assessment of the client's unique needs, including their skin integrity, postural requirements, functional abilities, and environmental factors. This aligns with the core principles of person-centered care and the ethical obligation of an SMS to provide solutions that are safe, effective, and appropriate for the individual. Specifically, selecting a cushion and back support system that offers appropriate pressure redistribution, postural support, and is constructed from materials that are breathable and easy to clean, directly addresses the client's risk factors for skin breakdown and promotes optimal function. This approach is further reinforced by the implicit understanding that such recommendations must be justifiable within any relevant funding or regulatory frameworks that govern the provision of assistive technology, ensuring that the chosen components are both clinically sound and administratively permissible. An incorrect approach that focuses solely on the client's stated preference for a particular aesthetic or a readily available, less expensive option without a thorough assessment of its clinical suitability would be professionally unacceptable. This failure to conduct a comprehensive needs assessment violates the ethical duty to act in the client's best interest and could lead to adverse outcomes, such as pressure injuries, postural deterioration, or functional decline. Such a decision would also likely contravene regulatory guidelines that mandate evidence-based practice and the selection of equipment that meets specific clinical criteria for safety and efficacy. Another incorrect approach would be to recommend components that are known to be difficult to clean or maintain, especially for a client with incontinence or other factors that increase the risk of contamination. This oversight demonstrates a lack of consideration for hygiene and infection control, which are critical aspects of client care and are often addressed in professional practice standards and potentially in healthcare facility regulations. Failing to account for these factors can lead to health complications for the client and potential liability for the practitioner. The professional decision-making process for similar situations should involve a systematic approach. 1. Conduct a thorough and individualized client assessment, gathering information on physical status, functional abilities, environmental context, and personal preferences. 2. Identify potential risks and challenges, such as skin integrity, postural instability, and caregiver capabilities. 3. Research and evaluate available seating components based on their clinical efficacy, material properties, durability, ease of maintenance, and compatibility with the client's needs and risks. 4. Consider any applicable funding, reimbursement, or regulatory guidelines that may influence equipment selection. 5. Collaborate with the client and their support network to discuss options, explain rationale, and obtain informed consent. 6. Document the assessment findings, rationale for recommendations, and the chosen intervention comprehensively. 7. Plan for follow-up and reassessment to ensure the continued effectiveness and appropriateness of the seating solution. Question 14. Governance review demonstrates a need to enhance the evaluation process for novel materials proposed for custom seating and mobility devices. An SMS is considering a new composite material for a client's seating system, which is advertised as lightweight and highly durable, but has limited published performance data specific to seating applications. Which approach best mitigates potential risks and ensures compliance with regulatory expectations for material selection? Option A. Conduct a thorough literature review of the material's properties. Consult with the manufacturer for detailed technical specifications and any available testing data, and perform a risk assessment based on the client's specific functional needs and anticipated usage patterns, including potential environmental exposures. Option B. Prioritize the material based on its lower cost compared to established alternatives, with the understanding that any performance issues can be addressed through future modifications. Option C. Rely on anecdotal feedback from other professionals who have briefly encountered similar materials, without seeking specific data on the proposed composite. Option D. Proceed with using the material based on its advertised benefits, assuming its performance will be adequate given its similarity to commonly used materials in other industries. The correct answer is A. Conduct a thorough literature review of the material's properties. Consult with the manufacturer for detailed technical specifications and any available testing data, and perform a risk assessment based on the client's specific functional needs and anticipated usage patterns, including potential environmental exposures. Explanation: this scenario is professionally challenging because it requires a seating and mobility specialist, SMS, to balance the immediate needs of a client with the long-term implications of material choices, all while adhering to specific regulatory requirements for device safety and performance. The pressure to provide a functional solution quickly can sometimes overshadow the due diligence required in material selection, especially when dealing with novel or less common materials. Careful judgment is needed to ensure that the chosen materials not only meet the client's functional requirements, but also comply with established safety standards and do not pose undue risks. The correct approach represents best professional practice because it prioritizes a systematic, evidence-based risk assessment. This involves thoroughly investigating the known properties of the proposed material, understanding its performance characteristics under anticipated use conditions, and critically evaluating its compatibility with the client's specific needs and environment. This aligns with the ethical obligation of an SMS to provide safe and effective solutions, grounded in current knowledge and best practices. Furthermore, it implicitly supports regulatory compliance by ensuring that the selected materials are appropriate and do not introduce unforeseen hazards, which could violate standards related to device integrity and user safety. An incorrect approach that relies solely on anecdotal evidence or the perceived novelty of a material fails to meet professional standards. This approach risks overlooking critical performance limitations or potential adverse reactions, leading to device failure or harm to the client. Such a failure could be considered a breach of the SMS's duty of care and potentially violate regulatory guidelines that mandate the use of appropriate and safe materials. Another incorrect approach that focuses exclusively on cost savings without a commensurate evaluation of material performance and safety is also professionally unacceptable. While cost is a factor, it must not supersede the primary responsibility for client safety and device efficacy. This could lead to the selection of substandard materials that compromise the integrity and longevity of the seating and mobility device, potentially resulting in premature failure and increased long-term costs for the client or healthcare system, and violating regulations that emphasize the quality and safety of medical devices. A third incorrect approach that dismisses the need for specific material testing due to the perceived similarity to existing materials is also flawed. While similarities may exist, subtle differences in composition, manufacturing processes, or intended use can lead to significant variations in performance and safety. Failing to conduct appropriate due diligence, including specific testing where warranted, represents a failure to adequately assess risk and could lead to the use of inappropriate materials, contravening regulatory expectations for device validation and user safety. The professional reasoning process for similar situations should involve a structured risk assessment framework. This begins with identifying the client's needs and the intended use of the seating and mobility device. Next, potential materials are identified, and their known properties are researched. A critical step is to evaluate the available evidence regarding the material's performance, durability, biocompatibility, and safety under relevant conditions. If significant gaps in knowledge exist, or if the material is novel, further investigation, including specific testing or consultation with material science experts, may be necessary. The decision should then be made based on a comprehensive understanding of the risks and benefits, ensuring compliance with all applicable regulations and ethical obligations. Question 15. Benchmark analysis indicates that a seating and mobility specialist, SMS, is tasked with evaluating a client's functional mobility to determine appropriate equipment needs. Which of the following assessment approaches best aligns with the principles of client-centered care and evidence-based practice as mandated by the SMS certification framework? Option A. Prioritizing the selection of the most technologically advanced mobility equipment available, assuming it will inherently meet the client's needs. Option B. Conducting a comprehensive assessment that includes direct observation of the client performing functional mobility tasks in their typical environment, subjective reporting of their goals and challenges, and consideration of environmental factors. Option C. Relying primarily on a standardized, static physical performance test administered in a clinical setting, with minimal emphasis on the client's home or community environment. Option D. Basing the assessment solely on information provided by the client's family members or caregivers, without direct interaction or observation of the client's functional mobility. The correct answer is B. Conducting a comprehensive assessment that includes direct observation of the client performing functional mobility tasks in their typical environment, subjective reporting of their goals and challenges, and consideration of environmental factors. Explanation. Scenario analysis. This scenario presents a professional challenge due to the inherent variability in individual functional mobility and the potential for subjective interpretation of assessment findings. A seating and mobility specialist, SMS, must navigate the complexities of a client's current functional status, their environment, and their personal goals to recommend appropriate equipment. The challenge lies in ensuring the assessment is comprehensive, objective, and directly informs a safe, effective, and client-centered mobility solution, while adhering to the specific regulatory framework governing SMS practice. Correct approach analysis. The correct approach involves a multifaceted functional mobility assessment that integrates direct observation of the client performing relevant tasks, subjective reporting of their experiences and goals, and consideration of their home and community environments. This aligns with best professional practice by ensuring a holistic understanding of the client's needs. Regulatory frameworks for SMS certification typically emphasize client-centered care, evidence-based practice, and the importance of functional outcomes. A thorough assessment that captures dynamic movement, environmental barriers, and personal aspirations directly supports the development of a mobility plan that is both clinically sound and personally meaningful, thereby fulfilling ethical and regulatory obligations to provide competent and appropriate services. Incorrect approaches analysis. Focusing solely on a standardized, static test without considering the client's dynamic functional abilities in their actual environment is a significant regulatory and ethical failure. This approach risks overlooking critical contextual factors that impact mobility and safety, leading to inappropriate equipment recommendations. It fails to meet the client-centered care mandate and may not be considered evidence-based practice if it neglects real-world performance. Relying exclusively on caregiver reports without direct client assessment is another regulatory and ethical misstep. While caregiver input is valuable, it cannot replace direct observation and client self-reporting, which are essential for an accurate understanding of the client's functional mobility and personal goals. This approach risks misinterpreting the client's needs and may violate the principle of informed consent if the client's voice is not adequately heard. Prioritizing equipment features over observed functional performance and client goals is a deviation from best practice and regulatory expectations. The primary focus of an SMS is to address the client's functional needs and goals through appropriate mobility solutions, not to promote specific equipment. This approach can lead to the selection of equipment that is not truly beneficial or even detrimental to the client's mobility and independence. Violating the duty of care. Professional reasoning. Professionals should adopt a systematic, client-centered approach to functional mobility assessments. This involves 1. Establishing rapport and clearly defining the purpose of the assessment with the client and their support network. 2. Conducting a comprehensive subjective assessment, gathering information about the client's goals, perceived limitations, and environmental context. 3. Performing objective functional mobility assessments, observing the client performing relevant tasks in various contexts, e.g., transfers, ambulation, navigating obstacles. 4. Integrating subjective and objective findings to identify functional deficits and strengths. 5. Collaborating with the client to develop a mobility plan that addresses identified needs and aligns with their goals, considering safety, independence, and quality of life. 6. Documenting the assessment process and rationale for recommendations thoroughly, in accordance with regulatory requirements. Question 16. Consider a scenario where a client expresses a strong preference for a very soft, plush cushion for their wheelchair, stating it feels the most comfortable during initial trials. As a seating and mobility specialist, what is the most appropriate approach to cushion selection in this situation, ensuring both client satisfaction and optimal functional outcomes? Option A. Conduct a comprehensive assessment of the client's postural support needs, skin integrity, functional mobility, and pressure distribution requirements. Then select a cushion that best meets these clinical needs while also considering comfort and client preference. Option B. Prioritize a cushion that is easiest to clean and maintain, as this will reduce the burden on the client and caregivers, even if it means compromising on some pressure relief features. Option C. Immediately select the softest cushion that the client finds most comfortable, as client satisfaction is the primary determinant of successful equipment provision. Option D. Recommend the most technologically advanced and expensive cushion available, assuming it will offer the best possible outcomes regardless of specific client needs. The correct answer is A. Conduct a comprehensive assessment of the client's postural support needs, skin integrity, functional mobility, and pressure distribution requirements. Then select a cushion that best meets these clinical needs while also considering comfort and client preference. Explanation. This scenario is professionally challenging because it requires balancing the client's immediate comfort and perceived needs with the long-term functional goals and the ethical imperative to provide evidence-based solutions. The SMS must navigate potential biases, client preferences that may not align with optimal outcomes, and the need to justify recommendations based on established principles and, where applicable, regulatory guidelines for assistive technology provision. The correct approach represents best professional practice because it prioritizes a comprehensive, client-centered assessment that considers multiple factors beyond initial comfort. This aligns with ethical guidelines that mandate thorough evaluation and the selection of assistive technology that promotes independence, function, and safety. It involves a systematic process of gathering information, analyzing needs, and matching those needs to appropriate seating and mobility solutions, ensuring that the chosen cushion and backrest contribute to the client's overall well-being and therapeutic goals. This approach is grounded in the principles of evidence-based practice, which is a cornerstone of professional competence in the field. An incorrect approach that solely relies on the client's stated preference for a soft cushion without a thorough assessment fails to meet the professional obligation to provide optimal care. This could lead to inadequate pressure redistribution, increased risk of skin breakdown, and compromised postural support, potentially violating ethical standards related to client safety and well-being. Another incorrect approach that focuses only on the most expensive option, irrespective of the client's actual needs or the availability of more cost-effective, equally functional solutions, could be considered unethical if it leads to unnecessary financial burden for the client or funding source, and may not align with guidelines promoting efficient resource utilization. An approach that prioritizes ease of maintenance over functional requirements might overlook critical aspects of pressure management or postural control, leading to suboptimal outcomes and potential harm. Professionals should employ a systematic decision-making process that begins with a thorough client assessment, including functional abilities, skin integrity, postural needs, and environmental factors. This is followed by an analysis of available seating and mobility options, considering their properties, benefits, and limitations in relation to the assessed needs. The process involves collaboration with the client and potentially other healthcare professionals, leading to a justified recommendation based on evidence and best practice. Regular reassessment is crucial to ensure the continued appropriateness of the selected equipment. Question 17. The investigation demonstrates that a client with progressive neuromuscular disease who has previously used a manual wheelchair is now expressing a strong desire for a high-end, complex power wheelchair with advanced seating functions, citing a desire for maximum independence and the latest technology. The Seating and Mobility Specialist, SMS, has conducted an initial assessment, noting the client's significant upper extremity weakness and increasing fatigue, but has not yet completed a full environmental assessment or trial of different mobility options. Which of the following approaches best aligns with the professional responsibilities and regulatory framework for a seating and mobility specialist in this situation? Option A. Conduct a thorough clinical assessment, including a detailed evaluation of the client's functional capabilities, environmental barriers, and potential risks associated with complex power mobility. This assessment should inform a comparative analysis of various advanced mobility solutions, including the client's preferred option, to determine the most appropriate and safe choice, followed by a trial period. Option B. Recommend a simpler, more basic power wheelchair model that is known to be reliable and easier to operate, as this will likely meet the client's fundamental mobility needs without the added complexity and potential for breakdown of a highly advanced system. Option C. Proceed with recommending the client's desired complex power wheelchair, ensuring all necessary documentation for funding is completed, as the client's expressed desire for independence is paramount. Option D. Focus on providing extensive training on the client's preferred complex power wheelchair, assuming that with sufficient instruction, the client will be able to manage its advanced features and overcome any initial challenges. The correct answer is C. Proceed with recommending the client's desired complex power wheelchair, ensuring all necessary documentation for funding is completed, as the client's expressed desire for independence is paramount. Explanation. This scenario presents a professional challenge due to the complex interplay of client needs, technological capabilities, and the regulatory landscape governing assistive technology provision. The Seating and Mobility Specialist, SMS, must navigate these factors to ensure the client receives the most appropriate and safe advanced mobility solution, adhering to established standards and ethical guidelines. Careful judgment is required to balance the client's expressed desires with objective clinical assessment and the limitations or requirements of available equipment. The correct approach represents best professional practice because it prioritizes a comprehensive, client-centered assessment that integrates clinical findings with the client's functional goals and environmental context. This aligns with the ethical imperative to provide services that are in the client's best interest and promote their independence and safety. Specifically, it adheres to the principles of evidence-based practice by considering the efficacy and suitability of different advanced mobility solutions based on objective data and professional expertise. Regulatory frameworks for SMS certification typically mandate thorough evaluations and documentation to ensure that recommended equipment meets established safety and performance standards, and that the provision process is transparent and justifiable. An incorrect approach that focuses solely on the client's initial request without a thorough clinical evaluation fails to uphold the professional responsibility to ensure the safety and efficacy of the recommended device. This could lead to prescribing a solution that is not clinically appropriate, potentially causing harm, exacerbating existing conditions, or failing to meet the client's underlying mobility needs. Ethically, this bypasses the duty of care and the principle of beneficence. Another incorrect approach that prioritizes the most technologically advanced or expensive option without a clear clinical justification disregards the principles of cost-effectiveness and appropriateness. This could violate ethical guidelines related to resource stewardship and could lead to the client being burdened with equipment that is overly complex, difficult to manage, or not necessary for achieving their functional goals. Regulatory bodies often expect justification for the chosen equipment based on clinical need and functional outcomes, not simply on features or price. A third incorrect approach that relies on anecdotal evidence or manufacturer marketing without independent clinical assessment is professionally unsound. This can lead to recommendations based on incomplete or biased information, potentially overlooking critical safety considerations or contraindications. Professional practice requires an objective evaluation of evidence and a critical appraisal of information sources to ensure informed decision-making that prioritizes client well-being and adheres to professional standards. The professional decision-making process for similar situations should involve a structured approach. 1. Initiate a comprehensive client assessment, including functional status, cognitive abilities, environmental factors, and specific mobility goals. 2. Review the client's medical history and any relevant diagnostic information. 3. Explore a range of advanced mobility solutions, considering their features, benefits, limitations, and suitability for the individual client's needs and environment. 4. Consult relevant clinical guidelines, research, and manufacturer specifications, critically evaluating the information. 5. Engage in shared decision-making with the client and their support network, explaining the rationale behind recommendations and addressing any concerns. 6. Document the assessment process, rationale for recommendations, and the chosen solution thoroughly, ensuring compliance with all applicable regulatory requirements. Question 18. Upon reviewing a client's skin following a seating system adjustment, the seating and mobility specialist observes a localized area of non-blanchable erythema on the sacrum. The client reports no pain or discomfort in that specific area. Considering the regulatory framework for seating and mobility specialists, which of the following approaches best represents the required standard of care for assessing this finding? Option A. Conduct a comprehensive skin assessment, including evaluation of the seating interface, client's positioning, and duration of pressure, and correlate findings with established pressure injury staging criteria. Option B. Immediately recommend a complete replacement of the seating cushion and back support, attributing the erythema to a fundamental flaw in the existing equipment. Option C. Advise the client to avoid sitting for an extended period and to apply a generic moisturizing lotion to the affected area. Option D. Document the finding as a superficial irritation and monitor for changes without immediate intervention, assuming the client's lack of reported pain indicates no significant issue. Correct answer is D. Document the finding as a superficial irritation and monitor for changes without immediate intervention, assuming the client's lack of reported pain indicates no significant issue. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a seating and mobility specialist, SMS, to interpret and apply complex clinical findings to a client's ongoing care plan, specifically concerning skin integrity. The challenge lies in differentiating between a superficial irritation and a more serious pressure injury, which has significant implications for the client's health, comfort, and the effectiveness of the prescribed seating system. Misinterpretation can lead to delayed or inappropriate interventions, potentially exacerbating the condition and violating the duty of care. The SMS must integrate knowledge of biomechanics, material science, and human physiology within the specific regulatory framework governing their practice. Correct approach analysis. The correct approach involves a systematic and evidence-based assessment of the skin, considering the client's overall health status, the characteristics of the seating system, and the duration and nature of contact. This includes a thorough visual inspection of the affected area, palpation for temperature and moisture, and assessment of the client's subjective report of sensation. The SMS must then correlate these findings with established clinical guidelines for pressure injury staging and prevention, as outlined by relevant professional bodies and regulatory standards applicable to SMS practice. This approach ensures that interventions are targeted, effective, and aligned with best practices for client safety and well-being, adhering to the ethical and professional obligations of the SMS. Incorrect approach is analysis. One incorrect approach is to dismiss the observed redness as a minor issue without further investigation, assuming it is simply a temporary reaction to the seating surface. This fails to acknowledge the potential for rapid progression of pressure-related skin damage and neglects the regulatory requirement for thorough client assessment and proactive risk management. Ethically, this constitutes a failure to provide adequate care and a breach of the duty to protect the client from harm. Another incorrect approach is to immediately recommend a complete overhaul of the seating system based solely on the presence of redness, without a comprehensive assessment of the underlying causes. This is an inefficient and potentially unnecessary intervention that may not address the root problem and could lead to increased costs for the client or payer. It bypasses the critical step of differential diagnosis and evidence-based problem solving, which is a cornerstone of professional practice and regulatory compliance. A third incorrect approach is to rely solely on the client's subjective report of discomfort without objective clinical observation. While client feedback is vital, it must be corroborated by objective findings. Ignoring objective signs of skin compromise in favor of subjective reports can lead to underestimation of the severity of the issue and delayed appropriate medical or therapeutic intervention, which is a failure to meet professional standards of care. Professional reasoning. Professionals should adopt a systematic, multifaceted approach to skin integrity assessment. This begins with a detailed history, including the client's mobility, sensation, nutritional status, and any pre-existing conditions affecting skin health. This is followed by a meticulous visual and tactile examination of the skin, paying close attention to color, temperature, moisture, and any signs of breakdown. The seating system itself must be evaluated for fit, pressure distribution, and material properties. Finally, all findings must be interpreted in the context of established clinical guidelines and regulatory requirements for pressure injury prevention and management. This integrated approach ensures that decisions are evidence-based, client-centered, and ethically sound, minimizing risk and optimizing outcomes. Question 19. The performance metrics show a significant increase in the client's ability to navigate complex indoor environments and a reduction in reported fatigue when using a new integrated sensor system on their power wheelchair. But the client expresses concerns about the system's responsiveness in low-light conditions and the complexity of its user interface. What is the most appropriate next step for the seating and mobility specialist? Option A. Advise the client to adapt to the system's current limitations, emphasizing the documented performance improvements and suggesting they will become more accustomed to the interface over time. Option B. Proceed with recommending the integrated sensor system for long-term use based solely on the objective performance metrics, assuming the client's subjective concerns are minor and will resolve with continued use. Option C. Conduct a follow-up assessment specifically evaluating the technology's performance in the client's typical low-light environments and explore options for simplifying the user interface or providing additional training. Option D. Recommend immediate removal of the sensor system due to the client's expressed concerns about responsiveness and interface complexity, prioritizing their immediate comfort over potential performance gains. The correct answer is C. Conduct a follow-up assessment specifically evaluating the technology's performance in the client's typical low-light environments and explore options for simplifying the user interface or providing additional training. Explanation. This scenario presents a professional challenge because the seating and mobility specialist, SMS, must balance the potential benefits of integrating advanced technology into a client's mobility device with the need to ensure that the technology is appropriate, safe, and effectively meets the client's functional and environmental needs, all while adhering to regulatory requirements and ethical considerations. The challenge lies in moving beyond mere technological novelty to a data-driven, client-centered assessment that considers long-term usability, maintenance, and the client's capacity to adapt. The correct approach represents best professional practice because it prioritizes a comprehensive, evidence-based assessment of the technology's impact on the client's overall function, safety, and quality of life. This aligns with the core principles of the SMS certification, which emphasizes client-centered care and the responsible application of assistive technology. Specifically, it requires the SMS to gather objective data on how the integrated technology affects the client's performance in their daily activities, their safety, and their ability to interact with their environment. This approach is ethically sound as it ensures that decisions are based on the client's best interests and are supported by demonstrable outcomes, rather than assumptions or the availability of new technology. It also implicitly addresses regulatory requirements by focusing on functional outcomes and safety, which are often key components of funding and service provision guidelines. An incorrect approach that focuses solely on the perceived, advanced features of the technology without assessing their practical benefit to the client is professionally unacceptable. This could lead to the provision of a device that is overly complex, difficult to use, or even detrimental to the client's independence and safety. Such an approach fails to meet the ethical obligation to provide appropriate and effective solutions, and could violate regulatory guidelines that mandate the provision of services that are medically necessary and functionally beneficial. Another incorrect approach that relies on anecdotal evidence or the opinions of other professionals without direct client assessment is also professionally unsound. While peer consultation is valuable, the ultimate decision-making must be grounded in the specific needs and responses of the individual client. This approach risks misapplying technology and failing to account for individual variations in response and environmental context, potentially leading to suboptimal outcomes and a breach of professional responsibility. Furthermore, an approach that prioritizes the latest technological trends over established, reliable solutions without a clear justification based on client needs is problematic. This can lead to the adoption of unproven or unstable technologies, increasing the risk of device failure, user frustration, and unmet functional goals. It deviates from the principle of providing the most effective and appropriate solution for the client's specific situation. The professional decision-making process for similar situations should involve a systematic evaluation. 1. Client needs assessment. Thoroughly understand the client's functional limitations, goals, environment, and preferences. 2. Technology evaluation. Research and understand the capabilities, limitations, and evidence base for relevant technologies. 3. Impact assessment. Objectively measure and analyze how the proposed technology integration affects the client's performance, safety, and participation in daily activities. This includes considering both immediate and long-term effects. 4. Risk-benefit analysis. Weigh the potential advantages against any potential disadvantages, including cost, complexity, maintenance, and user training requirements. 5. Client involvement. Ensure the client is actively involved in the decision-making process, understanding the implications of technology integration. 6. Documentation. Maintain detailed records of the assessment, rationale for decisions, and outcomes. Question 20. Examination of the data shows a client presenting with progressive neuromuscular weakness, significant postural instability, and a history of recurrent pressure injuries. The client expresses a strong preference for a backrest that is lightweight and allows for maximum freedom of movement, citing a desire to maintain a natural posture. The available backrest options include a highly contoured, custom-molded backrest with extensive lateral support and pressure-relieving contours, a modular backrest with adjustable components for postural correction and support, and a basic sling-style backrest known for its light weight and flexibility. Which backrest design and functionality best aligns with the client's complex needs and the professional responsibilities of a seating and mobility specialist? Option A. A backrest that is not yet commercially available, but is rumored to offer advanced dynamic support and aesthetic appeal, as it represents the cutting edge of technology. Option B. The basic sling-style backrest due to its lightweight nature and flexibility, which directly addresses the client's stated preference for freedom of movement and a natural posture. Option C. The highly contoured, custom-molded backrest with extensive lateral support and pressure-relieving contours, as it provides the highest level of postural stability and pressure management, essential for preventing further complications. Option D. The modular backrest with adjustable components for postural correction and support, as it offers a balance between necessary postural control and adaptability to the client's changing needs, while also providing pressure management features. Correct answer is D. The modular backrest with adjustable components for postural correction and support, as it offers a balance between necessary postural control and adaptability to the client's changing needs, while also providing pressure management features. Explanation. This scenario presents a common challenge for seating and mobility specialists, SMS, where a client's functional needs and the available backrest technology must be carefully aligned. The challenge lies in balancing the client's desire for a specific aesthetic or perceived comfort with the objective requirements for postural support, pressure management, and functional independence, all within the scope of regulatory guidelines for assistive technology provision. The correct approach prioritizes a comprehensive assessment that directly links backrest design features to the client's specific functional deficits and goals, as mandated by the ethical framework for SMS professionals. This involves a thorough evaluation of the client's current postural alignment, range of motion, muscle tone, skin integrity, and ability to participate in daily activities. The chosen backrest must demonstrably address these identified needs, ensuring it contributes to optimal positioning, prevents secondary complications, and enhances the client's quality of life. This aligns with the principle of providing evidence-based interventions that are client-centered and meet established standards of care. An incorrect approach that focuses solely on the client's stated preference for a particular backrest without a thorough functional assessment is ethically problematic. It risks overlooking critical postural needs, potentially leading to the provision of equipment that exacerbates existing issues or creates new ones, such as pressure sores or postural deformities. This failure to conduct a comprehensive needs assessment violates the ethical obligation to act in the client's best interest and could be seen as a deviation from best practice in assistive technology provision. Another incorrect approach that prioritizes a backrest based on its aesthetic appeal or perceived ease of use, without a clear link to the client's functional requirements, is also professionally unacceptable. This demonstrates a misunderstanding of the primary purpose of a seating and mobility device, which is to provide functional support and improve outcomes, not merely to satisfy superficial criteria. Such an approach could lead to a device that is aesthetically pleasing but functionally inadequate, failing to meet the client's essential needs and potentially causing harm. A third incorrect approach that relies on outdated or unverified information about backrest capabilities, without consulting current research or manufacturer specifications, is also a failure. The field of seating and mobility is constantly evolving, and SMS professionals have an ethical responsibility to remain current with the latest technologies and their evidence-based applications. Relying on outdated knowledge can result in suboptimal recommendations and a failure to leverage the most effective solutions for the client. The professional decision-making process for similar situations should involve a systematic approach. 1. Conduct a thorough, multidimensional client assessment encompassing physical, functional, environmental, and psychosocial factors. 2. Identify specific measurable goals for the seating and mobility intervention. 3. Research and evaluate available backrest technologies, considering their features, benefits, limitations, and evidence base in relation to the client's identified needs and goals. 4. Collaborate with the client and their support network to discuss options, ensuring informed consent and shared decision-making. 5. Document the assessment findings, rationale for recommendations, and the client's participation in the decision-making process. 6. Continuously monitor the client's response to the intervention and make adjustments as necessary.